Hi guys, welcome to today's presentation. As promised, we are going to look at the evaluation system of the Diploma in Nursing Training, and we are going to focus on KRCHN, that is the Kenya Registered Community Health Nursing. As we had covered in our previous sessions, we know this is a 3-year course, and in our last presentation, we looked at the clinical or practical examination framework. So today we are going to look at the theoretical examinations, or how are you evaluated from a theoretical perspective. So again, remember I mentioned that we either have the semester system or the block system. So you find for block system is offered in some of the private institutions and some of the mission institutions. The semester system is offered in some mission institutions and also the government-owned institutions such as KMTC. So this means that at the end of every semester, you're offered an end of semester exam. That means that in year one, semester one, you've covered 12 weeks or 14 weeks. At the end of that 12 weeks or 14 weeks, you're going to sit in for an end of semester exams before you proceed to the clinical placement or the clinical areas. Same as end of block exam. After you finish a block, you do an end of block examination, then you proceed to the clinical areas as you proceed with your training. For the semester system, we have exams at the end of, there are 2 semesters in a year, first and second semester. So you find that you will do end of semester exams and what we call promotional examinations. So promotional examination are also referred to as end of year exam. That means they will promote you, or you will do this exam so that you're promoted to the next academic year. So if you're in first year, at the end of the second semester, you will do a promotional exam. After passing that, that's when you can be promoted to second year. If you're in second year, the same way, you'll have to do promotional exam, or what you call end of year exam, for you to be promoted to third year or to the next stage. Now, the theoretical examinations, we have the practical assessments, what we call the assessments that we do when you go for your clinical placements or clinical rotations, and there are 7 in number for the whole period, for the whole training, that is for 3 years. You should have an opportunity to do a minimum of 7 practical assessments, and these assessments, there's always a tool, an assessment tool that is provided by the Nursing Council of Kenya, so that when you go to the clinical areas, lecturer from school and an assessor from the clinical area, 2 people assess you for the assessment and at the Nursing Council of Kenya. So it is a requirement by the Nursing Council of Kenya, so that before you are booked for the licensing exam, they'll have to ensure that you have done all the 7 practical assessments and you have passed. The pass mark is 50%. However, some institutions have set their own pass mark. So you may find an institution, maybe it's a mission institution or a private or other ministry, they have a variety of pass marks. But the bottom line, what is set by the Nursing Council of Kenya is 50%. So it is important for you to take note. What is the policy? What is the exam policy for institution? What do they say? Some institutions have it as high as 70% as the pass mark. Others have it at 60% as the pass mark. Others have it at 50% as the pass mark. So it is important for you to know what is the examination policy for your institution, so that you're not performing below the 50% or 60 or 70, thinking that you've passed, yet your institution has set its own examination standards. So the first 3 important assessments that you will do between your 9th to 18th month of training is the nursing care of a patient, management of a pregnant woman, and immunization. Nursing care of a patient can be done either in a medical ward, medical female-male ward. It can be done in a male-female surgical ward, or it can be done in a pediatric ward. But in most cases, not so much in pediatric, is majorly done in medical and surgical wards, unless there's inavailability of such opportunities. That's when it can be done pediatric ward. Now, It is 7th to 18th month of training. Then we have management of pregnant woman. Management of pregnant woman is done at the MCH. So this is where you assessed on how to manage a pregnant woman. Then you also have immunization. So ideally, in an ideal setup, the assessment should be in this order: the nursing care of a patient, then you go to management of a pregnant woman, then you go for immunization, as they build up on each other like that. And then we have management of a woman in labor. This is done between the 18th to 30th month of training. So what you need to understand, you cannot do management of a woman in labor if you've not done nursing care of a patient. You cannot do management of a woman in labor if you've not done how to manage a pregnant woman. So there's a flow of management of these patients. You start from the basic to the, as you advance to the complex ones. Besides the management of a woman in labor, we have management of babies at risk. This is carried out between the 18th to 30th month of training as well. So you can be able to see the management of a mother in labor and babies at risk is within the same period, 18th to 30th month of training. In an ideal setup, it should follow that order. There's no way you can do management of babies at risk and you've not done management of mother in labor. So it's the mother who comes first before the baby. Then we have MCHFP clinic management. So this is a management assessment that assesses you on how do you manage an MCHFP clinic, and this is always done with not most cases is not done within the wards, but in the rural placements. So in your part of training, if you can go back to what we covered in our last session, we had talked about rural placement or community health placement. So when you're in such placements, that's when you do the MCHFP clinic management. Then we have ward management. It's the last assessment of the training. So you can see both of the management is towards the end of your training. That's 28th to 36th month of training. So ward management will be in a ward setup whereby you'll be assessed on how do you manage a ward. It could be a medical ward, it could be a pediatric ward, it could be a surgical ward. If it's medical, it's either male or female, depending on the setup of the facilities that you use. So it is important for us to be aware of such assessments so that you are prepared, so that as you start off, ensure that you've passed assessment as they come, because sometimes you cannot proceed for the next assessment if you've not passed the previous assessment. And when that happens, then it is going to drag you, it's going to prolong your length of training within the institution. So we've looked at the theoretical evaluation, how you're evaluated, and we've said it's end of semester exams or end of block or promotional exams. Then practical assessment, we've seen that there are 7 assessments to be done for the whole training. The third category of assessment is what we call nursing care studies or projects, and you will have three care studies that you will be expected to do in your course of training. So we have the first one is the nursing case study. This one is just one, but can be either on a medical case, a surgical case, or a pediatric case. So it is expected in your training you'll be taken through how to conduct a case study. This is where you pick a client or a patient from the ward and you follow them up. It's a case study. You're taken through on how to carry out that one. Then we have midwifery case study or care study. Again, you select one client to be followed up at home prenatally and also postnatally after delivery. So and then the third one is community health nursing care study, whereby you will pick a client and you do a home visit just for community purposes, and it's ideally done when you go for your rural placements or your rural clinical rotations within the rural setups. That's when you're intended to do the case studies. Then you have a write-up and then its marks are going to be awarded. What we need to understand is that all these case studies or projects are going to be awarded marks required by the Nursing Council of Kenya or required before you do your final college qualifying examination. And in all this, will be required to carry out a home visit. So you may want me maybe to delve into details of how you conduct a care study. Maybe if it's a midwifery care study, a nursing care study, you can let me know, and then I'll prepare a presentation and take us through how you conduct these care studies, and from how do you select a patient, and how do you make it, or how do you take it to your lecturer for approval? After approval, now how do you go about conducting the case study? So let me know if you may want me to talk about or expand more on the same. Besides the case studies, we have research study, where you select a topic within the scope of nursing and then you do a research proposal, do a research project. So you can be able to see that all these projects and case studies and assessment and exams quite engaging. It's quite heavy for the 3 years, and that's why I always advise the students, by the time you're admitted in your training, your first day of admission is your first day of training. So if the whole of the first week you are dealing with admissions, orientation, induction, that means already we spent 1 week from our years of training. So it is important you set the ball running, be inquisitive, put that extra mile so that you're also not caught up with time, that towards your 3 years you realize you've not finished other assessments, you have care studies to do, maybe you have a client for midwifery, and they'll have to deliver, you'll have to participate in their delivery, you visit them at homes, and something like delivery, you cannot push it. It is a natural process that you will await for it to come. So it is good for you to plan your time, plan your studies, allocate time so that you're also not caught up with time. As soon as you're through with your first semester and second semester, you should start thinking of picking a client and start right away, because research, something like research, you cannot begin after first year, but after second year, then you need to start your research. But it is good to be thinking about topics, about research problems, so that by the time you finish with your year 2 semester 1, you already have a topic and you set the ball running. After that, as still part of the assessment or part of evaluation, then now we have the licensing written examination. Before the licensing written examination, maybe I forgot to mention, we have what we call the college qualifying examination, that is done after 3 years. Now when you're presented for college qualifying examination, it would mean that you have met all the evaluation requirements. That means you have passed all your theoretical exams, you have passed all your practical exams, you've passed and have the marks. It's one thing to pass and not having marks. So you've passed and have marks for theory, for practicals, your case studies and projects, you have finished and marks awarded. Your research, you have completed the proposal, you have completed the project and marks awarded. Then after that, now you are presented college qualifying examination. Now, for the college qualifying examination, it will be a replica of what is offered by the Nursing Council of Kenya, 4 papers, each lasting 3 hours. And for college qualifying examination, it has to cover what you did from your first day of training, what you're taught, what is nursing, to the last day of your year 3 theoretical sessions. And these exams would cover both what you will have covered in the practical setup and theoretical setup. Of course, it's a sitting exam, but the questions could be tailor-made such that you can be asked to manage a client with such and such a condition. What kind of medication would such and such condition be prescribed, and things like that. So it is important for us to take note of that. So you don't throw away your notes and books thinking once you're done, that's it. No, you'll be required to have them so that you'll refer them as you prepare and sit for your college qualifying examination or final qualifying examination. After you have passed your college qualifying examination, that's when your college presents you to the nursing council as having met or satisfactorily met the training requirements. Then you can now register for the licensing written examination, which will be provided by the Nursing Council of Kenya. Now, currently, they've been offering online examination, but there's a communication that they may revert back to the sitting or to the written examination. The online came about because of the COVID disturbances, but now because issues have normalized and we've gone back to our normal routines, there's of course not official, but there's a communication that nursing council licensing examination would go back to its original form. That's the sitting or the written examination, and that would be 4 papers: general nursing. We have paper 2, midwifery, gender, sexual and reproductive health. Paper 3, we have community health nursing and nursing management. Paper 4, we have general paper. General paper entails mental health, pediatrics, teaching methodology, curriculum, instruction, and research. So it's 4 paper in total, but they cover everything from your first year to your third year of training, covers content in your theory and practical session. So I think with that now we have a glimpse, or we have an idea of the overall training of nursing. So we've looked at the practical breakdown, the areas that you need to rotate. We've looked at the evaluation system. One of us requested me to take us through the units that are offered within each semester, and I'm working on it, so I should be able to present that in our next presentation. The subjects that you're going, or modules, they're called modules nowadays, the modules that you're going to cover in your first semester, second, third, fourth, etc. Of course, what I'm going to share is just a sample of what is offered with some of the institutions. And as I said, other institutions are run differently. So if what I'm going to cover may not be a replica of what is going to be covered in an institution that is doing the block system, but the contents are the same. So whether you're in private, whether you're in mission, whether you are in government-owned institution, whether you're in an institution from other ministries, what I am presenting to you is clear cut, is the same that is going to be, it's the same outline that is going to be, or that is being adopted by all institutions. The difference could be in the details. So I think with that now we are good to go. Feel supported. If you have any question, if you have any issue that you may want me to tackle pertaining to nursing training in Kenya, feel free to interact, feel free to comment, feel free to reach out, and I'll be able to do a presentation on the same, so that at the end of the day, we are well equipped to be able to go through the training, and it will be easier for you because you have the information firsthand. Thank you so much for watching. Until next time, take care, and God bless.